Urea is a substance used to treat dry or rough skin conditions like eczema, psoriasis, corns, calluses, and some nail problems like ingrown nails. It can also help remove dead tissue in wounds to aid in healing. Urea is known as a keratolytic, which means it softens and dissolves the tough substance, keratin, that holds the top layer of skin cells together, increasing moisture in the skin. This helps the dead skin cells to fall off and allows the skin to retain more water. When using Rynoderm Cream, it is important to follow the recommended daily dosage and apply it at the optimal time for maximum benefit. Make sure to use Rynoderm Cream as directed by your doctor or as indicated on the product package. Some products may need to be shaken well before use, so always check the label. Apply the cream to the affected areas of the skin or nails as directed, usually 1 to 3 times a day, and make sure to rub it in well until absorbed. It's important to wash your hands after applying, unless you are treating the hands. Remember to only apply the cream to the skin or nails and avoid sensitive areas such as the eyes, lips, inside the mouth or nose, and the vaginal or groin area, unless your doctor tells you otherwise. It's also important to consult your doctor or pharmacist for more specific details about where you should not apply the product. Additionally, ask your doctor if you should cover the treated area with a bandage or gauze. Using this medication regularly will help you get the most benefit from it. If your condition lasts or gets worse, be sure to let your doctor know. If you experience burning, itching, stinging, redness, or irritation, let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you notice any unusual changes in your skin, like blistering or peeling, or signs of a skin infection, contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, be sure to talk to your doctor or pharmacist. Before using Rynoderm Cream, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This cream may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, let your doctor or pharmacist know about your medical history, especially if you have skin cuts, infections, or sores. Some products in this cream may increase your sensitivity to the sun. Be sure to check the label for any warnings or ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you get sunburned or develop skin blisters or redness, be sure to inform your doctor right away. Additionally, some products in this cream may stain or discolor clothing, so it's a good idea to ask your doctor or pharmacist for more details. If you are pregnant, you should only use this cream when clearly needed, and it's important to discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so be sure to consult your doctor before using it while breastfeeding, especially if you are applying this product to the breast area. When using Rynoderm Cream, it's important to be aware of potential drug interactions. These interactions could affect how the cream works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Rynoderm Cream. If Rynoderm Cream is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Remember, it's important not to share Rynoderm Cream with others. This medication is specifically prescribed for your current condition, so it should not be used later for another condition unless your doctor tells you to do so. If your condition changes, a different medication may be necessary. If you forget to apply a dose of Rynoderm cream, apply it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular schedule. It's important not to use extra cream or apply it more frequently to make up for the missed dose. It's important to store Rynoderm cream at room temperature and avoid freezing it. Keep the foam product away from heat and open flame, and do not puncture or burn the container because the contents are under pressure. Make sure to store all medications away from children and pets. When it comes to disposing of Rynoderm cream, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.